Good morning, everybody. Thank you for being here. As we were talking just a few minutes ago on what seems like the first day of winter with the sleet coming down. Today's meeting, we're going to focus on the importance of community engagement and collaboration. As all of you doing this work know, you cannot effectively dismantle systemic racism, decrease the incidence of hate and bias, issues of equity and justice alone. That's work that has to be done in collaboration. And we're going to talk today about three ways that collaboration and sponsorship can directly impact the communities that we serve. And the first is around legislation. And we're going to hear from the Health Equity Compact, which is a collaboration of health and public health leaders of color who are committed to addressing racism and inequity in healthcare. And they have advanced a piece of legislation called an Act in Advance of Health Equity. This legislation would continue Massachusetts' priority of healthcare reform. You know, we sometimes forget that we were the first state to pass universal insurance coverage and payment reform to really bring down the cost of healthcare. This bill would prioritize health equity, standardize the reporting on health equity data, and improve access to and the quality of care. And we've seen repeatedly, and particularly here, I think in Massachusetts, how legislation can address structural racism and really change policies and systems. And this bill is an example of that kind of work. I encourage you to really listen to what's covered by this bill and learn how to support this. And I say this all the time because I think we don't realize that legislators will tell you that the magic number to get them to focus on a piece of legislation in the hundreds of pieces of legislation that are coming before them. So they have an amazing task of trying to get familiar with all of that. But the magic number to get their attention on a particular bill is 6. If they hear from 6 constituents about a particular piece of legislation, that really brings that to the forefront. So we talk a lot about how your voice matters, how your vote counts. When you think about 6, I'm sure in any community could get together 6 people here that would get your legislators really focusing on this. And again, I really stress it is very often not a desire not to support something. It is just the flow of business that makes it hard to get a piece of legislation through. The second thing that we're going to talk about is collaboration. Collaboration between municipalities and nonprofits really increases awareness of issues and advances positive incomes. And when you work together to address bias and access for marginalized and underrepresented groups, that's how we get to the positive change we want to see in communities. And as many of you know, we've really made prevention and intervention a hallmark of this office. And we've done that in large part by having both our traditional partnerships with law enforcement, but also really non-traditional partnership with community members. And this task force, as well as our opioid task force, are really good examples of that. And these meetings have helped us to raise new ideas, to identify needs across our county, and to make sure that residents' concerns are being addressed. And this past month was Domestic Violence Month. I know many of you observed that. We were with some of you to do that. And in conjunction with that, I want to talk about a partnership that we have recently announced. I am very optimistic about the difference that it's going to make, and it is that perfect kind of partnership. Many of you may know that Massachusetts recently passed legislation that makes community college completely free for anybody over the age of 25, completely free. You probably have noticed, as I have, that there hasn't been a huge push about that. You probably haven't been seeing billboards, you haven't been reading articles, you haven't been thinking about how people can take advantage of this. And one of the groups that I think, this can be important for everybody, but really can be transformative, is the folks that we see as survivors of domestic violence. Because, you know, work means a lot of things. Work means income. It means getting you out of a place where you might have stayed, even though it was not good for you because of economics. It means dignity. And for people who've been victims of domestic violence, who may have felt their dignity diminished by the way they were treated, it's a way to get back in that place. And for me, one of the most important pieces is, you know, everybody has seen the articles over the last few weeks. A number of our children, and in Middlesex County, we have 250,000 kids from kindergarten to grade 12 that go to school every day. And a number of those kids are not doing well. They're not going to school. They're not meeting educational or social expectations. Our absentee rates have grown dramatically. And in part, like with anything, the importance of education and showing up and learning is modeled behavior. So I can think of nothing better than somebody who is a parent modeling for their children. I go to school, I do my homework, we do homework in this house. We learn. This is how we move forward. So I'm very excited about bringing this prospect of community education to folks that we are working with our domestic violence partners. So we've begun that. We'll be very shortly conducting an information night, and really thinking about all the pieces that will make this work. We're going to be doing it on Zoom. We're going to have translators. We're going to do it in the evening. We have asked the community colleges to really, in showcasing their offerings, talk about what you can do remotely. So you don't have to pay a babysitter. You don't have to pay transportation costs. How can you get credit for things you may have already done? The traditional community college is 2 years, but you might come in with 6 months of credit. So now it's an 18-month thing you're going to be doing, much more attainable. On the other piece, there are 15 community colleges that we're hoping to partner with, so people all over the state can study what they want. Many of those colleges offer programs or certificates that lead to good jobs, the nursing programs, the LPN programs, all of that. But we're also looking to stretch this program even further, make it really transformative, because we're working on creating partnerships with some of our 21 colleges and universities where there would be an easy access point. So if you go to a community college, you maintain a GPA of whatever, 2.8 or whatever it is, you would then get admission automatically to one of these college programs. So now all of a sudden you're on track for a 4-year degree. So I think this is going to be an amazing program. It's a resource that is being underutilized, and that I believe is no better group to use that than our survivors. So that's a piece of really partnership. It's been our folks at the domestic violence programs who've helped us, Jackie Apsler and others, to do that. And the third piece we want to talk about today in that collaborative work is funding. Funding is, there's no question around it. Dollars help advance equity and racial justice. And right now, fortunately, we're sort of in a happy place where we're a little bit awash in the availability of funding money. And we want to make sure people are accessing those grants and other fundings, and thinking about ways to do that, ways to do it effectively, how to leverage the money that you're getting to move that forward. We've recently been successful in our partnership with Boston College's Center for the Thriving Child in getting some of the $100,000 EOPS grants to help us fund that work. So as you listen to today's speakers, I want to really encourage you to think about how you create partnerships that support the goals of your organizations and of the communities. Before we switch to that, I just want to mention, obviously, since our last meeting, we've all been grappling with the attacks on Israel that occurred on October 7th. And we have, not surprisingly, but sadly, seen a very dramatic increase in anti-Jewish and anti-Muslim activity across the country, and particularly here in Middlesex County. And some of that and some of the very concerning behavior happening on those 21 college campuses that we have across the county. And, discussing the issues in the Middle East can be very polarizing. We've got to be focusing on the common ground and on respectful conversation and helping people to understand. You don't have to agree, but understanding and respecting people's ethnicity and religious beliefs. And the hate and discrimination that have been on display for the last month have been really very concerning on on all sides. We've been working very closely with our college safety partners, local police departments. People have an absolute right to be out peacefully protesting, to be picketing, to express their views. But it's really imperative that people share information about other kinds of incidents and that we control those kinds of vandalism, doxing, things that have been happening that really terrorize parts of our communities. So we're going to share the incident report form again in our chat. Please post that form as many places as you have access to. So people who might not want to call a police department, but you see something, please put that information about what you saw. You can do it anonymously. It really helps us to have a sense of what's happening and to target our resources and our training around all of that. So I want to begin with introducing our amazing speakers today. We have a very, very full agenda to talk with us. And the first up is Gary Chu, who is the Vice President of Professional Affairs at the New England College of Optometry. Dr. Chu is an associate professor. He lectures students in the areas of geriatric and public health. And he's also the senior director of the Public Health and Community Collaborations at the College's Center for Eye Care. Dr. Chu received his Doctor of Optometry degree from the New England College of Optometry in 1995 and a master's degree in public health in 2002 from the Harvard School of Public Health. Dr. Chu's been involved in geriatric eye care since 1998 and has established relationships with many community organizations serving seniors as well as healthcare providers. He's spoken to many different audiences, including geriatricians, nurses, occupational therapists, social workers, optometrists, community groups. He's talked about visual health and function as it relates to elderly, fall prevention, prevention of eye disease, access to eye care, and the importance of low vision rehabilitation service. You know, one of the pieces, the other end of the spectrum, but as we've been working on access for kids, we continue to see, and I think we kid ourselves in Massachusetts about people's access to things like eye care. We continue to see numbers of kids who aren't doing well in school because they don't have appropriate vision care. And they spend their life in a blur, literally, of what they're able to see. We also have with us Suna Obera, from the Health Equity Compact. Suna is a recent graduate of Brown University. Since her graduation in 2022, she's worked as a senior policy and combination specialist with Blue Cross Blue Shield and currently works with the Compact. She's really passionate about equitable healthcare, specializes in what we're talking about today, that community engagement and legislation. And she is a member of the Alpha Kappa Alpha sorority as well. So thank you both for being here. And let me just tell people a little bit about the Health Equity Compact if you don't know. And I mentioned it's a group of 80 leaders of color advancing health equity across Massachusetts. Compact members are high-level executives and experts from a diverse set of organizations, whether it be business, labor, philanthropic organizations, hospitals, healthcare centers, all of those, really bringing lived experience, expertise, and commitment to this work of advancing health equity. So I'm happy to turn it over to both of you to talk a little bit about this new piece of legislation. And thank you for being with us.
Thank you, DA Ryan, and thank you for this task force for having us. Like the district attorney said, my name is Gary Chu. I am a member of the Health Equity Compact, and we want to highlight today, a little bit more about the Health Equity Compact, the importance of health equity, as well as the bill that's being introduced in the State House, which we had a hearing at the end of September. So we're going to go. So thank you for those introductions and for just the explanation of the compact. I just want to let everyone know, yes, we are 80 leaders and growing, and everyone is a person of color. Our vision, which is shared by many people in the state, is to eliminate systemic barriers and create new structures and processes that will lead to equitable healthcare, not equal healthcare, but equitable healthcare and health outcomes for all citizens of the Commonwealth. This hasn't happened yet, not because it can't happen, but because so far it hasn't been treated with a level of urgency. And many times we've been weathered and conditioned with the status quo, and we need to change that. Our mission is to realize bold statewide policy and institutional practice changes that centered racial justice and health equity. Next slide. It shows you who the members are, and you can see the diversity that is there. We're gonna, and the next slide, we're gonna focus a little bit more now on the health equity reform, but I wanna let you know why I'm involved. You know, you heard my introduction, I am an optometrist, but we have to remember I'm an optometrist, but I'm a healthcare provider, and if we don't work together and kind of hear the different stories and see the connections of where health leads. Sometimes it may start with a vision problem, but lead into other health problems. And the eye is the only place that you can actually see live blood vessels, and we can see things active, and it allows us to see a lot of systemic diseases. The other thing is we rely on our vision to do so much. Right now, we're relying on our vision to see. We also rely on our vision to learn, which the district attorney says, even with these great initiatives with community colleges. And then in my career, you know, I've dedicated my career to help people see. And usually we may center that around simply as physically seeing. But I realized in my career and in my life mission is to help people see goes beyond physical vision. It goes with the way we see things mentally, emotionally, and spiritually. And I want to help people see different parts of healthcare. And I hope that this presentation will help shift your perspective and how you can be involved. Sona?
Thank you, Gary. And I want to echo your thanks for having us in a space with everyone this morning. It is chilly outside, but it is warming to be here with all of you this morning. I was so moved by what you said, Gary, about us being weathered to these conditions. And I think that is really fitting for this slide right here. The compact, in conjunction with the Blue Cross Blue Shield of Massachusetts Foundation, commissioned this analysis to tally up the annual economic toll of health inequities in the state. And that's due to health inequities experienced by Black, Latino, and Asian populations here. Given the name of this group, Anti-Hate, Anti-Bias Task Force, I think we can all recognize the moral imperative of this work. There is a human price that is paid in terms of shorter, sicker lives, and that disproportionately falls on communities of color. And so what this report does is it gives us an understanding of the economic burden that is paid for by everyone in the state. And that's whether you realize it or not. This number comes out to almost $6 billion every year based on the cost of avoidable medical spending, lost productivity, and premature death. And when you add all racial groups, that includes white people, to this study, that number jumps up from almost $6 billion to over $23 billion. So we are all paying for this inequitable system. And we see that in a system that disproportionately burdens some, everyone loses. So the compact has 6 different policy priority areas. This list was worked through, workshopped, and came together in the spring of 2022. And this became the basis of our bill, An Act to Advance Health Equity, that has been referenced. This is not rank order of how we value these priority areas, but we do know that social determinants of health is not in the bill as much as we like, which is why we're having all of these stakeholder meetings and engagement events, because we want to advance those efforts through other mechanisms of advocacy. But moving on to the bill, this legislation, An Act to Advance Health Equity, is a huge and important step towards addressing the failings of our healthcare system and the root causes of health inequities across the Commonwealth. We are really appreciative of Chair Williams, Representative Garcia, Senator Pavel Payano, and Senator Liz Miranda as the lead sponsors on our bill. We were very intentional about having all of our lead sponsors be people of color and representing all the regions across Massachusetts. This is an omnibus bill. It's large, it's remarkable, and we also know that it's not all encompassing. As I said before, social determinants of health are not as focused on in this bill, and so we know that can be strengthened. And there are many groups in Massachusetts, this one being a perfect example, that have additional health equity priorities that aren't currently in the bill. So we encourage you all, as you listen to the rest of our presentation, and anyone that you know, to share with us your mission to use this bill and to use your priorities to advance health equity. And I'll turn it over to Gary in 1 second, but in Act to Advance Health Equity, this is an overview of the bill. Its purpose is to advance systemic changes to support the fair and just opportunity for everyone in Massachusetts to live healthy lives. And as you've heard previously, it can be broken down into these 3 buckets: prioritizing equity in state government, standardizing and reporting on data to advance health equity, and improving access to and quality of care.
And we're going to dive in a little deeper to each of the parts, but also to let you know, we did have the hearing back in September, and we actually filled the auditorium with 500 people. We testified in person, and it actually went way over time. And the Joint Committee on Healthcare Financing was very open to staying even longer so that every person who testified orally could be heard. And then there was many written testimonies, and we encourage you to do the same, and we'll tackle that a little bit later. But let's focus a little bit on the bill. The first is to prioritize equity in state government, and this is the first major part of the bill that focuses on that system-wide transformation by changing the existing structures in state government, by making equity a key function of the state. Health equity isn't just limited to the purview of public health. As we all know, it goes down through so many areas. So many other secretariats touch on these upstream factors that affect people's health, like housing, transportation, and education. And that was mentioned even with the DA's remarks. We also want to make sure state government includes leadership from communities of color. After all, government can only properly work if it is reflective of the communities in which it serves. We also want to be able to invest in health and not just healthcare for low-income populations and communities of color. We want to achieve this by creating a new cabinet-level executive office of equity to be led by a secretary of equity, similar to the new climate secretary that Governor Healy has added. And the secretary would be your partner in this work. We want to diversify gender, race, and ethnic compositions within leadership of key state agencies, boards, and commissions, such as the Health Policy Commission and the Center for Health Information and Analysis. And then we want to invest in community-defined and led efforts to build healthier communities by addressing the root causes of inequities. Sona?
The next big bucket in the bill is on standardizing and reporting on data to advance health equity. As DA Ryan said, we were the first state to pass universal coverage, and we need to be a leader in this aspect as well. Measurement is foundational to advancing health equity in multiple ways. It helps you identify disparities in care. It helps serve as a basis for payment models that incentivize health equity efforts, and it allows for public accountability. So while health disparities have been studied for decades, this change would require the standardization of measurement, and it has a far stronger emphasis on accountability and in state mandated processes. And the last bucket.
So then the other one is to improve access and quality of care. And we mentioned Massachusetts has always been heard as the leader, but there is still so much to do. And we need to make sure these gaps in coverages and rising costs for low-income communities of color are addressed so that we can reduce these healthcare and health disparities. And we also need to improve access to care. We oftentimes think of only, the greater Boston area, but as we go further to Central Mass and Western Mass, Cape and the Islands, we see access to care dropping off dramatically. And so these are things that we need to tackle. We need to provide full mass coverage for all people, address the increasing cost burdens, and then to require reimbursement parity, even for telehealth services. Those are new ways of delivering care that we have learned during the pandemic. How do we make that more equitable to help with primary care services and chronic disease management? And then going back to some of the things that DA Ryan said is authorizing a career ladder program for diverse workers. How do we improve that workforce? How do we provide that education? And it may start with going to community college, but it could lead to other things. So how do we think about those things differently?
Exactly. In conjunction with our policy priorities, we also have budget priorities. We've developed a list of them. Workforce is a top budget priority, an issue we know the legislation is acutely aware of. The compact is also supportive of funding health equity zones, as well as safety net and community-based providers. Lastly, that last bullet point, we are requesting full mass health coverage for all people who are otherwise eligible, regardless of immigration status.
There is a growing momentum. So beyond the work of filling a bill and having budget priorities, we're also working to convene and engage everyone across the state, because this change won't happen on its own. We must work together to make it happen, so we can amplify and clarify and bring together the threads of health equity in many different ways. And for me personally, vision, like I said, is important. We're going to have a Vision Health Equity Summit just to provide other areas. And I know my colleagues in oral health and in mental health are also thinking the same ways. So how can we think of health in a bigger aspect and how it all connects? Because our bodies are connected to one another and we are connected to one another. So how do we look at things differently? So we're going to continue to have that. We know that we've been collaborating with the Blue Cross Blue Shield, Massachusetts Foundation, that's developed an economic costs of inequities. We commissioned a health equity public opinion poll, and we held our first health equity trend summit back in May, back in June, which we'll do again. But if we look at the next slide, we can see some of the public opinion that's there. 96% of the people agree that everyone should have the opportunity to live long, healthy lives. We all know that, but sometimes we forget. And that's what I mean by seeing things differently, seeing things how it connects, and hearing people and hearing their stories, because that will also help us to see things. You can see 80% agree that some groups face more obstacle than others. 83% believe that state policymakers should give a fair or great deal of attention to improving health equity. And large majority support a range of potential policy priorities, with Black and Latino residents calling for a wider range of potential policy priorities. So this is something that's already innate in all of us, but how do we take it to the next level?
And lastly, these are some pictures from the Health Equity Trend Summit that Gary just referenced. This was in June. It was an amazing event. We had over 700 people watching this event. It was the first ever of its kind, the first time we've ever had key leaders across healthcare, business, and state government all coming together to talk about how we can make health equity a reality in Massachusetts. And so some topics that were covered during this day were embracing shared responsibility. How can all these different stakeholder groups come together, collaborating across sectors, embedding equity across all of our work, and centering and partnering with communities. And
so in closing, we want to take action. We want all voices to be heard. So you can still submit your written testimony in support of an act to advance health equity. And then we also want to know, are there ways the compact can partner with you in Middlesex County? I live in Middlesex County and want to be involved. involved statewide, involved with the Health Equity Compact, but how can we help all of you in Middlesex County? And then do you see alignment between the work of your organization and our policy priorities? And I'm sure you do. So we want to partner with you. We want to help you. We want to talk and hear your perspective. So any questions you have for us, we're very open to addressing. And then in this slide deck, two of our colleagues, Lindsay Tucker and Angel Borgen, can be contacted, or Sona as well, or you can look at us at the healthequitycompact.org. So questions?
I also just want to echo that we are really looking to partner and work with people across the entire state of Massachusetts. We have a series of virtual and in-person events that we've done in different areas. We had an in-person event. We fed people dinner in Lowell. We talked about health disparities in the region. We've done virtual events in Western Massachusetts. We're doing one in the Cape and Islands at the end of the month. So we would love to join an event that you're already doing. We would love to partner with you to create an event. I think we can get really focused in on the Boston area and right outside of Boston. And we as the Compact are really hoping to make this effort fully across the state. Antonia, I see your hand is raised.
Yes, you're up, hand up there.
Yeah, so as you were talking about diversity of gender and racial ethnic composition, especially in government agencies, it seems like the bill is very multi-layered in that the approach of creating equity and touching racial issues throughout the state. Can you talk a little bit more of how that's going to get done? I think it's definitely have to be done in collaboration, but who or other partners would be working with you to reach that goal?
So this is cross-sector. I think a really good example is that yesterday there was the cost trends hearing. That commission has previously been all white, and people have called it out for being all white and mostly male for the entire time that it's been created. And after a lot of push from stakeholders, a lot of focus, this year was the first time that there were 2 women of color who were on the commission. And what they brought is their own ideas, their own perspectives, and their own lived experience. So this work, it has to be very collaborative with a lot of key stakeholders pushing to advance this change.
Yeah, and I think also Governor Healy is very mindful of this, and she is filling different openings in boards and commissions across the state and asking different groups, because I also sit on the Massachusetts Asian American Pacific Islanders Commission, and we've been in contact with her office, and she has asked different groups of color to advance names that are often not thought about so that their voices can be amplified and their lived experiences and their connection with the state could be heard. And it's when we hear the different voices, then change starts to happen. We know it's not going to happen right away, but it is a start. We know that this bill is so big, we're not expecting to get passed, but at least we're having conversations. And if we can get more testimonies that are written to our state legislators to hear, like DA Ryan said, your voice matters. It takes 6 letters or 6 testimonies for things to be heard. But when we have more and more of those stories, then more things will change. We also know that because the bill is so great, so big, maybe parts of it can happen now as we continue to advance and continue to have these conversations.
And just one quick follow-up to that, because we know through COVID in our communities, there was barriers to getting people the access, whether it was just historical perspectives of people of color trusting the medical system.
Yes.
So I'm wondering what is we as those that are in our communities, how can we address that issue? And of course, I know our community stakeholders know the importance of health equity, but how do we reach others in the community that it's really affecting to let them understand how important this is? I hope I'm making that clear. It's not that people don't recognize it, but I think we want to empower those that it's most affected, that their voices will be heard and that there will be change. just some ideas of how do we bring them to the table as we do our community engagement.
I think that's where Sona talked about. We're having all these different conversations in different parts of the states. And I think with Compact members and others working together with community-based organizations and showing up and having those conversations, because sometimes people need to listen to other people's stories before they're empowered to tell their own. And so one of the key important things is that grassroots effort, going to different places and talking to individuals, talking to different groups. But we also know we have to do the higher order things like this cost trends meeting that happened yesterday, and placing people of color in different commissions or different parts of the government so that those voices can be heard. But we need to do both. We need to work all the way to the top and all the way down to the grassroots level in order to develop that trust. And unfortunately, we live in a society where trust has been eroded because of history, but how do we start building it up? And it seems like it's harder to build things up than to break things down, but it doesn't mean we can't try. We need to keep moving forward and encouraging others, not just young people, but all people. Like, we all have lived experiences, and sometimes we're beaten down that we're afraid to speak. And I know myself, it was during the height of AAPI hate that a lot of things came out that me and my wife and our family have these discussions, and I've grown tired of that. And so that I'm now using my voice. And that's why I joined the Asian American Pacific Islander Commission. That's why when the leaders at the Health Equity Compact asked me to join, that's when I said, hey, I've had enough, and now I'm going to have my voice heard. I'm no longer afraid to tell my story and to the experiences that I had growing up, and then hoping that that will help others tell their stories. I continue to encourage my students to tell their story, and I'm starting to tell my story and encouraging others to see different perspectives. And that's why when I say my mission in life is to help people see, but not just that physically, but the spiritual, the emotional, and the mental. Because the more we can hear that and shift focuses or shift perspectives, we will help people all grow.
Scott, did you have a question?
Yes, I was just I know, and thank you, DA Ryan, for hosting this, and Gary and Sana for presenting. Great work. My only question, so I know for district court we're rolling out a mental health court, and I'm sure we're going to try to get some data with respect to the disparities and outcomes in the criminal justice system related to behavioral health and mental health for people who are incarcerated and things like that. And I was wondering if there's if your group has reached out on the criminal justice side to see what other ways we can lower these kind of disparities.
We haven't, and that is an amazing point that you bring
Yes.
up. I would love to hear more from you. I'm going to put my email in the chat. I think there's a lot of opportunity there for alignment.
Thank you.
Those are great comments. So true. And I would also, if you're thinking about mental health, think about vision health too, because there's been a lot of studies showing that when individuals can't see, especially a child can't see, not only affects their mental health, but in partly because they can't see, they'll be disruptive and lead to so many different things. But there are so many root causes. So I'm glad you brought that up, and I'm glad Sona is going to take your name, but that's definitely something we need to address or partner with too.
Catherine, did you have a question? Catherine?
Oh,
Oh,
hi.
there you go.
Sorry.
That's
Yeah,
okay.
just to follow up on Scott, I'm wondering about following up with other issues that cause these inequities, housing and food insecurity being huge. And I would just add to Dr. Chu, I was a pediatric nurse. Hearing really affects children. And we found that was a huge problem for some of our children. So I'm just wondering, housing, and the other piece is, have you reached out to the religious community? Because I do see this as some way in which folks often will trust their religious leaders in a way that they don't trust healthcare leaders. Thank you.
In terms of the social determinants of health, that is why that first provision in the bill is on embedding equity at the state government level, because we know having a Secretariat of Equity then informs the Department of Housing, Education, Public Safety. We need equity at the very top so that every secretariat, every department has that equity lens as they're working. So housing is absolutely a priority, and that's why we have that provision in the bill about having a Secretariat of Equity.
And I think
Yes.
yeah, I'm just saying in regards to religious organizations like churches, we know a lot of communities of color trust churches. And even yesterday at the Costrand Summit, there was a pastor who gave testimony. And definitely there's connection there. And I know the compact will be working with those individual groups because, like I said before, we're really also focusing on communities. And we know building trust in communities involves community leaders, and leaders come in all sorts of professions, not necessarily just health. Sometimes it's just someone who's passionate, who wants to make a change, and we're going to work with all those individuals and groups.
Mel, did you have a question?
No, I just thank you, Dan Ryan, for hosting this today. I just wanted to kind of follow up on both Scott and Mrs. Thompson's point about I wanted to find out when is the next scheduled hearing on the H 1250 S 7799 bill, and what kinds of cultural collaboratives have you already built, and what kind of response have you received from those collaboratives as to the impact of this bill on their particular communities?
So I am not sure when we'll have the next bill hearing. We had one so recently that it'll probably be in the next legislative cycle that we'll have another one. But you can still submit written testimony, and we encourage anyone who feels that that this legislation would positively affect your life or your community's life to submit written testimony. It's good to keep that momentum up even after the bill hearing. And to your point about community and voices, this bill was written based off of different task force, different working groups, different small group settings that got community input. So that was embedded in the workings of the bill. We have continued to have these community engagement events afterwards to share about the bill, to talk about different disparities in different regions of the state. But we really wanted to include that community voice in the actual creation of the bill.
All right. Well, thank you. Lots to think about and appreciate you both being with us today. Now to
Thank
talk
you.
talk a little bit about the collaboration pieces. Many of you know I'm from Somerville. I started working as a DA in Somerville, and credit lots of the things that I saw and learned in Somerville with the work, with the pieces that we have put in place here. For instance, the city of Somerville has created a Department of Racial and Social Justice. And that department really leads the city's equity efforts and collaborates across the city with city departments, constituents, and stakeholders to eliminate the institutional and structural systems that create those racial inequities, the social disparities, and injustices. And they are fortunate enough to have Denise Molina Capers as the director of that program. And Denise is an educator and a change agent. She's really, as you'll see, passionate about leveraging organizations to improve workplace cultures around equity and inclusion. She has a demonstrated history of working in public policy, as well as the education management industry. And she's skilled in so many things: social justice, law, the nonprofit world, diversity training, management, and really change, how you build change in an organization. And with that skill set, she brings a great deal of clarity and objectivity to her work as a leader. Her mindfulness inspires patience and perseverance, strategic planning that encourages sustainability and a positive mindset. In a city as diverse as Somerville, you need all of that to get things done. Denise has spent the last 20 years helping organizations really strategize around how to inspire growth and opportunity. And one of the things I saw in Denise's bio that I really love, because I think we all need this, is that she really sees life as a process, and even small successes are important because they lead to the big win. So I'm happy to have Denise here with us. And as well from Somerville is Greta Hagen, who's the Director of Philanthropy and Education for Respond. And Greta's really been honored to have that position, engaging the community in its support of Respond's critical housing, shelter, outreach, and advocacy services. She began her fundraising career in a large nonprofit development office, but she caught her stride in the small shops and brings almost a decade of experience leveraging this more holistic, community-based approach to resource generation in her role at Respond. And through her work and the board service, Greta has been involved in lots of housing debates, racial justice work, support for women, giving birth to children while in custody. But she's especially passionate about empowering survivors and advocates and ensuring they have what they need to work together to end domestic violence. And her social justice work, and I've seen this so many times, is really inspired by young people's activism and their desire to leave the world a better place for the next generation, including her own child. Greta holds a bachelor's degree in political science and Spanish literature from McGill and a master's of political theory from the University of Toronto. She serves on the board of the Malden Chamber of Commerce, and she is a powerhouse. If you've ever been to the Respond galas and events, you see the kind of work that Greta does in this area. So I'm really happy to have both of you here today to talk about how municipalities can partner with their nonprofits to make some change. So thank you both.
Thank you, Marian. Good morning, everyone. I am on my second cup of coffee, which I very rarely do, but coffee helps my brain regenerate brain cells. Thank you for that introduction. I very often forget how long this road has been. I've actually been working in the civil rights and social justice sector since I was, believe it or not, 7 years old. My dad was an activist, and I still remember those days where I used to go on marches and speak and things of that nature. So it never left my spirit, and it was definitely in my blood when I was born to advocate and activate empowerment for my community. And my dad always said, you know, you are doing the right thing in life when you wake up every morning and you love going to work. And that definitely is the case for me, except when I wake up with my 4-year-old's foot on my face. That's a little bit different. But having said that, I am very happy to be before everyone today and represent the city of Somerville and the Department of Racial and Social Justice. This department was established in March of 2021. However, it was developed and requested in 2019, while all the racial injustices and police brutality incidences nationally were happening. The then Mayor Kota Tony decided that he was going to have a listening session for the community of Somerville. And within that listening session, what ended up emerging was that they wanted a department that would hold the city accountable to its effort of eliminating structural racism, as well as eliminating other social injustices that intersect racism. And so they hired me in 2021. They said, develop what the department is going to look like. This should be a part of your mission to eliminate structural racism. And part of your mandate is going to be to develop the RSJ Fund, which will help community members be a part of eliminating structural racism. A task force that will help us develop a civilian oversight board, as well as reimagining policing. So not a hard task at all, right? So we went into developing the mission first. If we can have the next slide. And so the Department of Racial and Social Justice leads the City of Somerville's equity efforts and collaborates with city departments, constituents, and stakeholders to eliminate the institutional and structural systems that create racial inequities, social disparities, and injustices. Now, there are three, last I researched, there are three departments in the United States that have this specific mission. However, the only department that is directly reporting to the mayor is the City of Somerville's RSJ department. There is no other department that directly reports to the mayor. Most of them report to Human Resources, the DEI director, Human Health and Human Services, but none that report directly to the mayor. And that is important because it allows the director in this position to make actual changes to policies and procedures. It allows the director to come before governing elected bodies and say, these ordinances need to be looked at again. Next one, please. And so in developing the department, we also figured that, you know, when you say reimagine policing, it's not about policing, it's about public safety. And so the first step that I took was changing that title to public safety for all, because what's safety for me is not necessarily safety for someone else. If I live in Ward 1, safety for them means one thing. If I live in Ward 4, safety for them means another thing. And I know Greta definitely understands what I'm talking about. And so we developed the RSJ department, which meant what kind of staffing do we need in order to make sure that the work that we are doing is sustainable, that we don't have people who are burning out, because in this industry, it is very easy to burn out emotionally, mentally, physically. And what does it mean to break these things down so that we are doing them efficiently and we're working smarter, not harder? And so I'll share with you some of the positions that we have. We currently have 9 staff members in the department, and we are about to hire 1 more. So then we developed what the department programming would be about. We developed what public safety means and how we would start getting this information. We also took in the ADA division. We took in 2 commissions, which was the Human Rights Commission and the Women's Commission. Within the ADA division, we took the Somerville Commission for Persons with Disabilities. And then the city did not have any kind of hate and bias incidents complaint process. And so we've been developing that. We are almost at the point where we are finalizing the policy and the process for community members to be able to file complaints. That's not to say that we don't currently take them. That means that we will officially have a policy backing up what hate and bias incident complaints process and tracking and prevention and looks like in the City of Somerville. And then in addition to that, we have different structures for equity, which include internally and externally. Next, please. All right. If you want, Antonia, you can speed this up until it shows all the little boxes. So many times people create these divisions or these departments, and I think there's one more, there you go. Many times people create these divisions or these departments, and they say, have at it. Get rid of racism, get rid of hate and bias incidences, make sure that everybody feels happy, it's equitable and inclusive. But what's missing in this is that this is not something that happens in a year. It's not anything that even happens in 2 years. This is something that realistically speaking, you will start seeing some of the change in the 4th or 5th year. But in the 1 to 3 years, you are setting yourself up for success. There's a foundation that needs to be built, because we don't want this to become another effort that dies out. We want this to be something that is sustainable. We want this to be something where we're taking into account all the identities and demographics that are included in the city. And we want to make sure that we're not telling people, we want to know what you think, we want to know what your thoughts are, and then we don't even take it into account because, oh, there's no budget for it. Oh, there's no time. Oh, we have to move forward on this quickly. No, intentional, slow process, baby steps creates sustainability and the ability to have an actual budget, to have staff that can sustain it, and to have other collaborations that don't just include internal city departments, that actually include community partners, because community partners are key to understanding the community, to building trust and building legitimacy. And so if we look at this chart, what we're looking at is thinking about what does it mean to create structures for equity and enact a comprehensive theory of change. So like I said, it's not a 1-year process. It's more like an estimated 5-year process. And we can imagine that years 1 and 2 are preparation and capacity building. You're learning about the city. What do we need? What are our demographics? What does the census say? What are some surveys that have already been done that can inform our decisions moving forward? Years 2 and 3 are focused internally on our institutions and transforming them. What are our city departments doing? How much training have they had? What are some policies that we can look at right now that have to do with community engagement or community inclusion and equity? And start really talking about transforming them. So even just developing a method for our internal city departments to have ASL interpretation was one small thing that we did because no one was doing it, but it was absolutely needed. So in our 2023 budget, we requested money so that we can fund any city department that needs ASL services when they're doing community events. Years 3 and 4 are focused on transforming the communities, because at this point, you've already done the surveying, you've already spoken to community members, you've brought them in. And years 4 and 5 are focused on healing and transformation and systematizing what it means to heal and transform, because we can't pretend to ignore the history of what people have gone through, of what people have experienced, how they felt unheard, whatever the case may be for the particular city. So we need to be able to address that through and through. There needs to be healing, and then there needs to be transformation behind that healing. So across those 5 years, we will have worked to develop a system and tools necessary to analyze, prevent, and address institutional and structural racism in the city. And throughout, we acknowledge and affirm the community's needs, wants, and lived experiences. You can go to the next one.
Oops.
Thank you. So if we focus in on just the public safety for all, we developed this as a multi-tiered, community-driven initiative to create and shape public safety policies and engagement that will advance racial and social justice across all economic classes, ages, genders, races, ethnicities, and identities. And so with every single initiative that we have, big or small, project, program, we always develop the mission, the vision, the value, and the purpose. And this is important because there's a favorite of, let's create a task force, let's create a committee, let's create a group. But then somehow, some way, the values, the mission, the purpose, the vision gets lost. And so it's important to develop these before you even begin, because it helps you maintain what the mission is about. It helps you maintain those constituents that you have to make sure you understand are mostly impacted by the work that you're doing. And it helps you maintain focus on not just people's opinions within the committee, but actual facts that need to be addressed. And it helps you to think of implications, think of challenges that may come up, and start to address those proactively. And so the values of the PSFA initiative is to be in line with the City of Somerville's priorities. And it embodies the values of equity, transparency, accountability, innovation, and social justice. And so I'm not going to read all of this, but I will say that in doing this work, we had to break down the various tasks around the PSFA initiative. We developed an anti-violence working group, which specifically is going to be looking at the data, working with SPD, working with the police department to take a look at the top 5 violent crimes. And they're developing recommendations behind how we can reduce, intervene, and prevent those top 5 crimes. Then we have the Public Safety for All Task Force, whose mission is to develop recommendations for a potential emergency response model and to look at the data that we collected from the Public Safety for All survey around what key areas are our constituents most concerned about and needing more resources. The Civilian Oversight Task Force has the mission to develop recommendations behind what a civilian oversight board could look like for the city of Somerville. So all of these are basing their recommendations on evidence-based data. They're working with various city departments and experts, city staff, and also Somerville community members. And the beautiful part, which people tend to forget, is if you want community members to participate, you need to give them a stipend. We forget that people have children. We forget that people need daycare. We forget that people work full-time jobs. We forget that transportation still costs money. And so all of the task forces and working groups that our department develops get paid. And I'm not talking minimum wage. So we support, with the exception of city staff, obviously, because they're already getting paid. But the experts get paid as consultants, and so do the community members. And so if we're talking about community engagement, what does this look like? The first piece is making them a part of the task forces and working groups, give them a seat at the table. No one can speak better than the people who are actually experiencing it themselves. Many times we want to say that we understand and that we know what is needed because we look at the statistics, but there's nothing that speaks more boldly and more loudly than the actual person who's going through it. And so we need them at the table. And we need to make sure that identities and demographics are being taken into account so that the task forces and work groups represent the actual makeup of the city. So other ways in which we can ensure that there is community engagement is making sure that there's language access through translation, through outreach. We translate as many things as possible. When we go door knocking with members who can speak the multiple language that exist in the city. We know word for word if we need a Spanish translator, a Portuguese translator, Haitian Creole. We are very familiar with what our constituent word to word looks like. And so we go prepared to be able to address any needs around language justice or even people's comfort level. So we also have a Department of Somerville Office of Immigrant Affairs who helps us with translations of documents. Everything, even on the website, is translated as well. Facilitation of our events has translation as well. Community partners is very, very important because, again, our community partners are the ones that help us build trust and legitimacy. The first 2 years of my role as director of the department, it was near impossible to get constituents to talk to me. I had to go every single day to those areas in the city that felt the most neglected and be there for at least 2 hours, just standing outside of the building, saying hello to people, explaining who I am. I definitely had an advantage because I'm multilingual. However, it still was not easy to build that trust, but finally, we do have more of the community's trust. But some of our partners, as you guys know, is Respond. Our neighborhood associations, we reach out to them on Facebook, on Twitter. We have constituents who have signed up to be a part of our email blast and text message blast, and they help us get the word out. We target many of our Somerville communities based on the issues that they voiced specifically, but we use various methods: text messaging, social media, through our webpage, email blasts. We do robocalls, we do flyering, you name it, we do it. So, and this is not to say everything that we do also has a communication plan. We strategize very much. We're very intentional. It is not easy. We had to extend our survey to be almost a year and a half long. But because of that, we were able to have the most demographically, statistically matching, sorry, my brain. We were able to get over 1,000 residents to respond to the survey, and it matches exactly statistically to our demographics in the city of Somerville, which was something that had never been done before. And for being a survey that has to do about policing perceptions and public safety, we were very proud to be able to accomplish that. I'll hand it off to Greta. Or I don't know if you want us to do questions first.
Why don't we let Greta go? I just want to make sure we get everything and then we'll put the questions in.
Well, hi there, everybody. And DA Ryan, thank you so much for having us. And thank you so much to Denise for planting the seed. Really grateful. I thought that I would just share a little bit about who we are, but very quickly, and then talk about you know, our collaboration, especially with RSJ. So I am Greta Hagen. I am the Director of Philanthropy and Engagement at Respond. And we are the domestic violence agency that is based in Somerville. We are the first domestic violence agency in New England and the second oldest in the nation. So are you seeing all of this? Okay, so here we are. So we partner with the community in the mission to end domestic violence. There's my little friend Desiree here. All of our services are free, they're confidential, and they're available to survivors regardless of any of their identities. So we serve men, we serve non-binary folks, we serve folks of all racial backgrounds. And I'm going to talk a little bit about the collaborations that we have that make that possible. I'll talk a little bit about our programs just to give you an idea. So starting this winter, we were able to develop a whole new division, or kind of break off a division of our programming because of some significant funding in the housing world. So before, we had kind of housing work as part of all of our case management services, but we have been able to really expand that. So now we have these two divisions. We have our housing and residential services division, where we're really working with survivors who are at that intersection of survivorship and housing insecurity or homelessness. So we do operate an emergency family shelter where we serve families who are fleeing imminent violence and really have that impossible calculus, right, of leaving an abusive relationship and ending up homeless, or staying and enduring that abuse. We have a very robust housing program. So we have transitional living units where we have leases that we are filling with survivor families for up to 2 years. We also offer a pretty robust rental assistance program that could be first, last, and security. That could be support with paying off arrears for folks. And that even includes rental assistance over a longer term period, where we might lower the percentage that we are paying on behalf of a survivor over the course of their lease, while their share increases, just to help folks get on their feet. And last year, we launched a brand new program for survivors who are 18 to 24 years of age and either pregnant or parenting, or both. We recognize that there are special needs for those young parents, and So we're especially excited about the expansion of community college access for the folks leaving this program, though really excited that it's available for everyone. But we have a youth specialist who works with these young families to meet all of their kind of safety goals, their goals for justice, but also their education goals, make sure that they have the childcare that they need, and the education supports for both themselves and for their children. In our community-based services division, we have a community intervention and education program. So we are running a support line out of our main office in Union Square. We have support groups. We have one-on-one counseling and case management. And we're also going into schools, and I'll talk a little bit about that in just a sec. We are also embedded at the Suffolk County House of Corrections. So we're working with survivors who are detained or incarcerated, mostly on the women's side at South Bay. We're also working with post-release folks, so survivors who have been released from custody, and going back to Essex County, Plymouth County, Norfolk, Suffolk, and Middlesex counties. So we're working with Women in Transition, the program in Essex County. We work with the post-release program in Billerica, just making sure that folks have the supports that they need to avoid recidivism, to avoid re-victimization after they leave incarceration. And as part of this program, we also have our law enforcement partnerships program. So we're embedded in 6 police departments. We're in Malden, Melrose, Wakefield, Woburn, Reading, and Wilmington. We're not embedded at Somerville Police Department, but we work very closely with their victim advocate there. We are all covered by 20K privileges, so which means that nothing that is shared with us needs to be shared with the court or the police department, which is not true for police department advocates. So we work really closely with Maureen here in Somerville. She'll say, I'm going to stop you right there. Do you want to talk to an independent advocate? Let me respond on the phone. And likewise, if somebody really wants to more embedded support navigating the criminal legal system, we will get the advocate on the phone. And for our other community partners, we are both of those things, right? We're providing that confidential support, but also helping folks navigate that system. We're following up on every police call made in those municipalities that reference domestic violence or that look to us like they could be domestic violence. We also operate, we have founded and continue to facilitate the high-risk teams, both. So we have 3 that we co-facilitate with the DA's office. So we're in the Malden high-risk team. We co-founded and facilitate the SMART team, so Stoneham-based, and the Somerville Medford high-risk team. So we're working to make sure that survivors who do not leave their community for shelter are supported in community, and that we hold perpetrators accountable in those communities. All of this is possible only because of collaboration. We couldn't do any of that without community collaboration. So I'm just going to share a little bit mostly about our collaboration with RSJ. So we have, like I said, law enforcement and criminal justice partnerships. We work in the statewide coalition of domestic violence and sexual assault providers. So that's Jane Doe Inc. So we're part of that coalition and work in tandem with other domestic violence agencies. We work very closely with mental health providers and other community providers, including intimate partner abuse prevention programs, culturally specific programs, anything that's going to help a survivor access all of the supports that they need. As I mentioned, we're in school, so we're in the Woburn Memorial High School. We were invited by students to lead workshops in Revere, so we're at Revere High School, and we're newly in Somerville schools in their therapeutic alternative program. So we're at the Next Wave Full Circle middle and high school programs, offering not support groups, but psychoeducational programming that really highlights healthy relationships, gives kids the tools that they need to have successful relationships, which I think none of us really get training in that, right? So it's really an asset. And per usual, the kids are training us along the way and really helping us hone those programs. We work closely with our funders. Much of our housing funding comes from the Executive Office of Housing and Livable Communities, formerly DHCD. And so we are administering funds to keep folks safely housed or to find them housing through those partnerships, also the Department of Public Health. Community members support our programs, volunteer in our programs, make those programs work. And then government agencies. And I'm just going to share a little bit more about this. But of course, central to all of this, the biggest partnership we have is the survivor that's sitting across the table from us or on the other end of the phone line. You know, survivors know what they need to seek safety and justice. They are the experts in their own story and in their own recipe for resilience. And so I want to just make sure we're highlighting that that collaboration is so important. And then finally, I want to talk a little bit about government agency collaboration. I met Denise when she first started, when RSJ first started, and she was a department of one. I'm super excited that she is no longer a department of one, although she really held it down. And we met because of the domestic violence vigil that we had been partnering with the Somerville Commission for Women to host a vigil that honored the lives taken in the last year by domestic violence, and kind of was a place where we could recommit as a community to ending domestic violence. So that's where I met Denise, and I am so grateful for the partnership with RSJ. We are now, she has this whole great, wonderful team, and we're able to connect with them on different levels. And it's really opened some doors for us that really have gone beyond that vigil, which we just completed, and it was wonderful again to work together. We are also a member of the anti-violence working group that she referenced. Domestic violence, we know, shows up in all wards, as Denise says, right? All different socioeconomic sub-communities in Somerville, and it shows up differently in different communities. And so we're really excited to work with this group to kind of bring our expertise, but also learn a little bit more about that, the way we can work, best address folks' needs in different communities. We also, RSJ was instrumental in shepherding a grant request we put forth through the ARPA, the American Rescue Plan Act, to the city of Somerville, that was not only to support client services, but really was a workforce development program for our staff, many of whom are people of color, mostly women of color, mostly parents, many of whom cannot live in Somerville because it's too expensive, though we keep trying to make sure that we are, paying a living wage. That's really important to us. But this proposal enables us this year to really make more robust our training program, to give stipends, to offer additional sick time for COVID reasons, to have temporary staffing. While we are short-staffed, we were impacted by the Great Recession, like all of our community partners. And so to be able to have that investment, not just in the services we provide, but in the staff that provide those services, has been really, really significant and influential. So this is my public thank you, Denise, but that's one of the ways that we're super grateful to be partnering. And then it's opened other doors. We now have pretty constant referrals from the Somerville Office for Immigrant Affairs and are able to work with them. We're able to have those young parents get better access to Summer Baby, which is a program for parents in Somerville. So our connection to RSJ has just, we've been in Somerville for 50 years and we've worked with the city through many administrations. And this has just, the creation of RSJ and this partnership has just kind of enabled us to really rise to the next level of serving survivors from all different demographics and really made our programming more equitable. And I just want to say thank you. So I'll end that, my sharing here, and happy to answer any questions, or have questions, go to Denise.
Thank you. Questions for Denise or Greta? Mel.
Question for Denise. I'm just looking at your calendar, your schedule here, the 1 to 2 year preparation and capacity building, and then your 2 to 3 year, your institutional transformation. Question is, what kinds of things have you, in your conversation with the community, have you found to be the things that they've identified as being the most crucial and impactful? And second, given the number of racial challenges, particularly in Middlesex and Suffolk, what have you seen these biased organizations? Have they had any negative impact in terms of Somerville as to like racial challenges, racial biases, violence towards communities of diversity in those communities? Have your organization seen that, and what kinds of actions have you thought about in terms of strategies to address it?
Forgive me if I forget pieces of the questions.
Don't worry. Take it piece at a time
No
because it's.
compound questions in law,
I know. In the morning, I know.
Your Honor. So to answer the first question, some of what our constituents have noted, and again, this depends on what ward we're in, and the constituents that are responding. There are variations in terms of what people are requesting, in terms of what people need in order to feel safe. It can be as simple as, we just need more lighting in the street area. We need more crossing guards in a particular area. Some of the constituents have requested not necessarily defunding police, but more so we want a relationship with the police, so that when I'm doing a third shift to pay for food for my kids, and my kids are outside playing, that they understand and they know who those kids are, and they can talk to my kids versus thinking that they're up to no good. So they really want a relationship with police officers. The last time that the city of Somerville had an incident of violence was about 10 years ago. And so what we are working with is really getting people to understand that the work that we are doing is local based. And although we are disheartened by what's going on nationally, our circumstance is different in terms of what we need to reform and what we need to work on. And what Ward 1 is asking for is not necessarily the same thing that Ward 5 is asking for. And so we need to take that into account, because when the Public Safety for All Task Force is doing the recommendations for the emergency response model, one of the things that we are letting them know is that it's okay for you to create more than one, and it's okay for you to create a hybrid version, because what's good for the east side of Somerville may be very different for the west side of Somerville. And so that has to be taken into account, that there is not one cookie cutter way to do this. You can't see what's being done in Oregon, what's being done in Colorado, what's being done in California, and say, you know what? Let's piece this together for Somerville. It doesn't work that way. You have to look at the data. You have to ask people multiple times. You have to be that thorn on their side, because if you're not, you are not doing it in a way that's going to be sustainable. You're not going to be able to make the case, because we always have to make the business case. You're not going to be able to make the business case for why we need this amount of money. And the key is always, how are we going to make this sustainable? How are we going to make the community a part of the process, so that we know that what we are developing is what's going to work and what they will respond to. The second question, I'm sorry, can you repeat the second question?
There's been a notable number of organizations, racially biased organizations, that have been embedding themselves in different communities, challenging communities of color and diversity. And I'm curious to see, have your organization in any way been not only impacted or even been informed of these racial challenges? You know, separatist organizations like that, who specifically target communities that have, you know, people of color and diversity, and they're setting up challenges, setting up subset groups in those particular communities to undermine, to racially challenge residents in the community. And it's interesting you point out, like, different portions of Somerville, you may see some action in one portion that may not be in the other portion. And I'm just curious, have you seen any of these racially groups, like for example, because you saw those groups come in Boston, for example, and I'm just curious, have you seen the same thing in Somerville?
So the answer is yes. Are they as bold as they have been in other cities? No. They're more covert. I will be honest and say that there have been people who have followed me. There have been people who we have. The reason why we have a public information officer in a division specifically for community engagement and public relations is because there are many things that go hand in hand with being informed and doing this work. And part of it is what are people on Twitter saying? What are people on Facebook saying? Many times we are informed because we are on social media and we know what's going to happen. And so we're able to strategize and be proactive around how are we going to do this. So there have been times where we know that there's going to be some kind of a setup. And so we change locations and we do not announce the new location. We only send out the text blast to people who have told us that they want to be a part of the programming or the event. And that's why it's necessary for us we spent a year going to the different areas in the city for those who are mostly impacted and really haven't felt like they had a voice. We got their specific emails, we got their specific text numbers to be able to text message and email them. And that was very important for us to be able to have because they do it in very covert ways. And you know, that's the not so pretty side of doing this job, because my face does not represent hope to some people. My face represents a danger to advantages, a danger to what has previously made people more privileged. And so being able to connect to what's going on outside of our department within those smaller groupings and being able to connect with community leaders who know what's going on the underground is very important for us. So we don't pretend to know everything. We definitely depend on our community partners. And when I say community leaders, I mean your next door neighbor who knows what's going on down the block that the news is not going to tell you about. Those are the people that we try to connect with as well.
Any other questions? All right. Well, thank you both. We were planning to have Raul Gonzalez talk to us a little bit about the Metropolitan Area Planning Council and some of the funding issues. That is so important, and I want to be respectful of people's time that Raul has agreed to come back for our next meeting, which will be on December 14th. So I want to thank all of our presenters for today. We will get the information out to people. If you have questions for any of the presenters, just get them to us, or if you can't reach them directly, we will get them out there. Thank you, Antonia. Thank you all for sharing your morning with us. Be safe. Have a good Thanksgiving. Take care. Bye-bye.